The Battle for Minds. Britain expands project on mental health in terrorism. London, Reuters. A project looking at links between mental health and terrorism in 3 English cities has been expanded nationwide after it found a significant number of people referred to counter-radicalization programs suffer some form of mental illness. Studies have suggested the prevalence of mental health issues among militants working together on major strikes is very low, but a string of killings by so-called lone wolves has fueled concerns mental illness could be a factor behind some attacks. Authorities say some of those involved in 4 attacks in Britain this year blamed on Islamist militants appeared to people who had self-radicalized via the internet and whose mental state had been questioned. To look more closely at the issue, British police launched pilot programs in April last year in England's 3 biggest urban areas, London, Birmingham, and Manchester, to embed mental health experts with counter-terrorism officers. The aim was to give psychiatrists the chance to identify people referred to Britain's counter-radicalization program PREVENT who had mental health issues and treat them. Anecdotally, I am surprised that there appears to be a much higher prevalence of people with mental health problems than you would expect, said Professor Jennifer Shaw, the mental health lead for Greater Manchester Police, referring to the people her team had dealt with since the pilot was launched. The hubs are considered so successful by the government they have been expanded nationwide, Shaw, professor of forensic psychiatry at the University of Manchester, told Reuters. But such is the secrecy around the work of PREVENT and Channel, a de-radicalization program within the overall project. There are few details about its successes or failings in Shaw's work has not previously been discussed in the media. Some psychiatrists argue that no scientific link between mental health issues and terrorist attacks has yet been established, and they worry the program's risks stigmatizing people suffering from mental illnesses. Another psychiatrist gathering data under the pilot programs told Reuters that Britain's Office for Security and Counter-Terrorism had told them not to disclose any details of their findings ahead of a final report. Those findings are expected to be among a raft of data about people referred to PREVENT due to be released this week. Britain's Interior Ministry did not respond to requests for comment. We want the facts. Adrian James, registrar at Britain's Royal College of Psychiatrists, RCP, said the link between mental health problems and terrorist acts had not been established. He said a lack of evidence, partly because militant attacks were so rare, was at the heart of the problem, adding that an unnecessary level of secrecy about PREVENT also meant many psychiatrists viewed the program with suspicion. If it is true that there is a link, we need to know, and then need to look at the causes of that, and what we can do about them, James told Reuters. We just want the facts. Past studies have disagreed about the significance of mental health issues among lone wolf attackers, with some academics concluding that such illnesses are blamed to try to explain often complex reasons for attacks. British police decided to launch the pilot programs because they believed that roughly half the 7,500 people referred to PREVENT each year had a broad range of mental health and psychological difficulties. Those working on the pilot projects hope the information being gathered will now help experts assess any possible links between mental health issues and attacks. Shaw said determining who might be a potential attacker from mental health problems alone was not really feasible and fraught with problems, but she said it might be possible to ascertain the characteristics of people most likely to be at risk and ensure they got appropriate help. That doesn't mean you can't manage the risks. Trying to nip it in the bud, that's all you can do. But that's good. If you can achieve that, it's going a long way, said Shaw. Police officers say they have struggled in the past to reach medical practitioners when they had concerns about some people, and Shaw said the pilot was designed to address those worries. According to one of Shaw's case studies, a man went to a hospital saying he monitored Islamic State websites, had been walking around the city center working out how many people he could kill in a gun attack, and wanted to behead his mother. Shaw's team discovered the man had no contact with mental health services and no diagnosis of any illness. An urgent assessment concluded his anger stemmed from experiences in his childhood and safeguarding measures were put in place.